So in the emergency department, we see people from all different walks of life, but in particular, many people who are at high risk of actually having HIV and perhaps not knowing they have HIV because they do not have access to either primary care or other prevention and testing services. Turnaround time certainly determines whether or not providers in the emergency department are actually going to want to do the test, because in the emergency department we have tremendous pressure in terms of patient flow. So people want to be seen at a reasonable time, which means we need to be able to see our patients, make decisions, and discharge them home or admit them to the hospital. If turnaround time is the key let's say, factor that is inhibiting us from making those decisions about where patients should go, then providers are less likely to actually order the test.
How do you implement something new in the emergency department? And now, that we're expanding this to multiple sites, my job is more to scroll out and to be sort of responsible for everyone talking to each other, for supporting the sites to get this up and going, since I've been through it before myself. The job was really to talk to everybody in the emergency department about what we were doing, to figure out what the barriers were going to be, to figure out how to bypass those barriers. It was working with the laboratory experts to figure out how this was going to happen, how we were going to get samples from one place to another. So I was very deep in the nitty-gritty of how to get this done.
It's an important innovation. It lowers barriers to testing in the community. We know sometimes people who may not have access to primary care or routine public health come into emergency departments for many different needs. So I think it does a remarkable job in lowering barriers to testing and ultimately lowering barriers to care.